Chapter 4, medication orders and documentation. All right, so the first term that you need to highlight is stat. Stat, you'll probably hear it in movies and things like that. That means immediately. So I need to give this drug right then, not at the end of my shift, not in 30 minutes, not in an hour. The physician wants me to give that drug right then. Usually it's in an emergency situation, so he may give you that order verbally. He cannot give you a verbal order. You're not licensed. Only a nurse can accept a verbal order. Okay. All of your orders must be written or faxed to you. Okay. Prescriptions, again, are given in outpatient settings. So that's like if you and I go to the pharmacy and, well, to the doctor, and he gives a prescription to us. We take it to our pharmacy or he calls it in. Medication orders are for our residents that are in long-term care and inpatient settings. Okay. So they need a medication order for everything. Okay. We're going to skip over to slide 6. Slide 6 is where I want you to highlight that statement that says medication aides should not receive stat medication orders or administer emergency medications. Okay. So if he calls you and say, hey, I want to start this new medication, you say, okay, but can you fax that order to me? If he's in the building or she's in the building and say, hey, I want to start this new medication, you say, okay, can you write the prescription out or the medication order out? All of your stuff has to be already written or typed. Okay. All right, we're going to skip to slide 8. All right. So slide 8 goes over the components of a complete medication order. All of these components must be on the order. If it's not included in the order, then that order is not legal. It is not legal. Okay. So when we look at the first element that we must have, it's the identification of the resident. Okay. So you have two patient identifiers, name and date of birth. Okay. So when you walk into the room, you knock, you say, hey, my name is Miss King. I'm going to be your nurse today. Would you mind verifying your name and date of birth? Okay. So that's how I know if I have the right resident. Then on this order, it's going to have the physician name of whoever prescribed it. And then the drug name. We have to have what are we giving, right? So it has to have the drug name on the order. So for instance, we're going to say Tylenol. Our patient name is Mary Jane. Her date of birth is 12/12/1912, and her doctor is Dr. Rowe. The drug that he is prescribing is Tylenol. The next element that we must have is the strength. How much of this Tylenol are we giving? We're going to give 325 milligrams. Okay. What form is it coming in? Is it going to be a liquid? Is it going to be a tablet, a patch, an injection, a suppository? It's going to be a tablet. Okay. So my order will say tablet. The dose. How many of these 325 milligram tablets is she going to take in one sitting? He ordered 2. So in actuality, she's going to get a total of 650 milligrams, okay, of Tylenol. You see that? All right, and then the directions for use, we're going to administer by mouth or PO every 8 hours, PRN, which is as needed, for mild pain or fever greater than 101. Those are the only 2 reasons I can administer that Tylenol. All right, those are the only 2 reasons. And then that complete medication order will have whether they have refills or not. Okay. So do you understand that so far? Right. So if any one of these are missing, let's just say that the milligrams, the strength is missing from that order is not legal. And you can say, well, it's just Tylenol. He probably meant because now you're the physician. Okay. So it's not what he probably meant. It's, oh, we got to call the physician and get him to send in the correct order. Okay. So you always, when you find an error, you always report it to your supervisor first. Okay. Now we done went through what that order must contain. Now, before we give that order, before we fulfill that order and administer that medication, we need to go through our 6 rights of medication administration. These 6 rights make sure that I am giving the right patient the right medication, the right dose, the right way at the right time, and I'm documenting it the correct way. Okay, so in order for us to know we have the right patient, again, we got to use those 2 patient identifiers. Verify your name and date of birth for me. And when they're verifying it, I'm looking at my MAR and I'm looking at their name and their date of birth to see if it's correct. Okay. Now, right drug. How do I know that I have the right drug? So, what I'm going to do, I'm going to look at the medication label and I'm going to compare it to the MAR. And so my medication label on here says amoxicillin. So on my MAR, it needs to say amoxicillin. On here, it says that they're going to have 400 milligrams per 5 mLs. It needs to say that on here. But she's going to take 10 milliliters of it. Route, giving it by mouth. On my MAR, it needs to say by mouth. Okay. All of it has to match. If the label and the MAR does not match, what do I need to do? I need to stop and I need to go and report that to my nurse. Okay. Right time deals with medication window. You need to write that down. Medication window. With the medication window, we have an hour before and an hour after to give a med. So if a medication is scheduled for 8 a.m., I can give it as early as 7 a.m. and then I can give it as late as 9 a.m. But guess what? 9:01, it is too late. Okay? So just remember that. One thing also that you need to be mindful of is that the medication window does not apply to every med. So, for instance, it doesn't apply to narcotics. Narcotics, if it says that you can't get it for 4 hours, you can't get it for 4 hours to the exact time, down to the second. Okay, you can't give it early, right? And then blood thinners, that's another example. Those have to be given at the same time each day because you have to build up the levels in the system. Okay, so it's some medications that do not fall within that medication window. Right documentation. Once I have observed my resident actually swallowing the medications, that is only then when I can document that they took it. Okay, you don't document before because things can happen. If I sit here and I document before and then go give them the pills, I get in the room, what if he refuses? I get in the room and what if he spits them out? What if he chokes? What if he's not in there? What if he's not alert? What if he's dead? Okay, so that may be extreme, but that is honest. What if you walk into the room and he's not alive? So now you've just falsely documented that you administered something and you didn't. Okay, so those are your 6 rights, right? Patient, drug, dose, route, time, and documentation. You have to be able to answer each one of those rights for every patient, for every medication that they take. Okay, when I say MAR, that's just referring to the medication administration record. Okay. For military times, I gave you a handout for that. I don't really spend too much time going over military time, but just quickly, if we're dealing with PM, so PM we're going to start with 12 noon. That's lunchtime, 12 p.m. When you're dealing with PM, the only thing that you're doing is adding 12 to whatever the hour is. Okay? But you also can keep in mind that we're starting at 12. So you could just start counting 12, 13, 14, 15, right? So if I want to say that it is 3 o'clock p.m. in military time, all I'm doing is adding 12 to 3. And so that's going to give me what? 1500. So then I would say meet me at 1500 hours. They will know that's 3 o'clock, 3 p.m. Now when we're dealing with AM, okay, because since you can write 12 a.m. as 4 zeros, we're going to stick with that. So if I want to say it's 1 a.m., all I'm going to do is put a 0 in front of the hour. So I would say meet me at 0100 hours. Okay, so for PM, I'm adding 12 to the hour. For AM, I'm putting a 0 in front of the hour. Okay. All right. Now I want you to skip to slide 14. Slide 14 gives you an example of what a EMAR or a MAR just period could look like. So if you look at the bottom, you'll see the resident's name. His name is Jim Johnson. He's his DNR code status. He's in room 100. His date of birth is 2/20/1957. His doctor is Dr. Rowe. He has no known allergies. He's on a regular diet. All of these things we need to know. And then his diagnosis. He has hypothyroidism, hypertension, AFib, CHF, and dry eyes. So with hypothyroidism, so his thyroid isn't functioning properly. Okay? It's low functioning. Hypo is low. So the medication that he's going to take for that is the levothyroxine. You can almost see thyroid being spelled in the middle of that term, right? The brand name for levothyroxine is Synthroid, which also you'll see thyroid almost being spelled in that name. So the levothyroxine is 75 micrograms. He's going to take one tablet by mouth daily. Daily means once a day. And you see the hour, he's going to take it at 6 a.m. Usually at 6 a.m., there's no breakfast trays out. So that should jump out at you and say, hey, he got to take this medicine on an empty stomach. He got to take this medicine on an empty stomach. Synthroid or levothyroxine absorbs better on an empty stomach. Also, he can't have dairy products with this med. Dairy products, your milk and things like that, they coat the stomach. Just like Pepto, that's a dairy product, right? It coats the stomach, which is going to affect the way that it is absorbed into the system. Okay? You say, well, Ms. King, I don't know all that. Well, you use that drug reference book. It's going to tell you all of this. And also how they have it on the MAR. I don't want you to rely on that, because what if the pharmacies didn't put the directions on the MAR? But they should put it on the MAR and say, hey, don't give with this, or give only on the empty stomach. Okay? So at 6 a.m., I'm able to give that as early as 5, and I could give it as late as 7. I'll go ahead and give that. The next one is quinapril. He has hypertension, so he has high blood pressure. Okay? Quinapril, 20 milligrams, one tablet by mouth daily. He's going to take that at 8 a.m. I could give it as early as 7, as late as 9. But I have to check his blood pressure before. Check your own vitals. Check your own vitals. If you see that you are giving a blood pressure medication, check the blood pressure prior, because you don't know if they woke up that day with a blood pressure that's already low. And then what will happen is, if it's low and you go and give them this quinapril 20 milligrams, it's going to continue to lower it. Now we got to deal with somebody that's hypotensive. We got to get their blood volume back up. We're going to have to send them to the hospital. Check the vitals before you give meds. Okay. So now look at the comment. The comment says that we are to hold this medication if the systolic pressure is less than 120. So, and the only way that I can give this medication is if his systolic number, the top number of his blood pressure, it has to be 120 or higher. That's what that comment means. So if I took his blood pressure this morning and it said that it was 119/80, can I give that med? No, I can't give that med, because it did not fall within the correct parameters. It's below 120. So what I would do, I would put my initials there, and then I'm going to circle it if I'm using paper charting. When I circle it, that's letting people know that I did not administer that dose. Okay? And then right below it, I will put the blood pressure that I got, which was 119/80. Okay? All right, look at digoxin. So this resident also has atrial fibrillation, or we call it short AFib. So that's an irregular heart rhythm. So we're going to give them digoxin, 250 micrograms. They're going to take one tablet by mouth every day. We have to check the pulse first. If you look at the comment says do not administer if the pulse is less than 60. So the pulse has to be 60 or higher in order for me to give this med. So if it's 59, I'm not giving it. If it's 60, I'm giving it. 61, I'm giving it. Okay. So that is how you read your MAR. Okay. Here, if I have a medication that I did not give, just like the quinapril, because the blood pressure was 119, I will, if I'm paper charting, I will come here on the back of my paper charting on my MAR, and I'll put that date. I'll put the hour that it was supposed to be given. My initials. I'll put the medication. I'll put the quinapril 20 milligrams, and I'll put the reason why I didn't give it, and I'll just write the blood pressure there, 119/80. It doesn't have to be a synopsis. Just give me quickly, okay? And then you sign it off. You also, when you have PRN medications, because if you take a look here back on slide 14, look at the PRN, they have acetaminophen 500 milligrams, 2 tabs by mouth every day, every 4 hours for headache. So it's PRN. You see, there's no time like the other ones. That's because they have to request this med. They can request it at any time, but they can only get it for every 4 hours. So when I get ready to administer this, I have to come here on the back. So I'm going to put the date, the hour that she asked for it, what the medication was, the acetaminophen, and why she asked for it. She can only ask for it for a headache because that's exactly what he prescribed it for. She can't say anything else. And another thing, if this patient here has a fever, and you say, well, I can give him Tylenol, you can't, because that order does not say I can give that for a fever. It only says headache. So I would have to call the physician, or the nurse calls the physician and say, hey, can you give us an order for her acetaminophen to be given for headache and for fever? And you say, well, it's not a big deal. It's very much so a big deal, because if you administer this for any other reason that it was not prescribed for, you're practicing as a physician. Okay? And that is not a legal order. So I'll come here, I'll put the reason. So she got Tylenol or she got acetaminophen. The reason was a headache. I'll put headache there and sign it off. With PRN medications, you have to check up on them, whether it's 30 minutes to an hour. So if I gave that Tylenol at 8 o'clock, 8:30 or 9 o'clock, I'm going back to that resident and say, hey, did it work? And then they say, yeah, my headache is gone. I'll come here, and they'll have an area on my MAR that says response. So with the response, I'll say effective. Or if she said that it didn't work, then I will write ineffective. Okay. But that is called a PRN follow-up. Okay. All right. If you skip to slide 17, this is going to show you what a EMAR will look like on the computer. So it's still the same information, just now you will see his picture at the top of it. You will see the medications listed here. They'll also have pictures. Well, this one does. Has actual pictures of the meds, what I love. Because for if you're ever preparing meds and you're like, dang it, I done forgot what I done dropped in this cup and I done threw the pack away. Well, if it has a picture of it on the MAR, then you can find out. But if it doesn't have a picture on the MAR and you say, well, crap, I don't know what this med is, every pill has an identifier on it. So all you have to do is type it into Google, white round pill with I-28 on it, and it's going to tell you exactly what it is. Okay. That's just an example of what we went over. All right, so slide 25. When we are working with narcotics, usually your narcotics will come on a card that looks like this. And then they're going to have numbers on them. Okay, so they have numbers on them, and even on the back, you see the numbers. Okay, so this card houses 31 pills, 31 tablets. Each narcotic sheet, and I gave you a narcotic sheet in your folder. Each narcotic that comes into the facility will come with a narcotic sheet that you have to document on. That's it, the first one. It's going to come with this same drug information that's on there. It's going to have it on that paper. Okay. And it's going to have how many tablets that they sent into the facility. So at the top of it, it'll say 31. For quantity, it'll say 31 tablets. Every time you administer a dose off of that card, off of that narcotic card, you have to write it. You have to sign it out that you gave it. Because that is keeping account. Okay. We have to keep an accurate account of all narcotics. So as I use it, let's just say that this card was filled with 31. I pop this out and I give the med, and then now I have how many left if it was 31? I got 30. So I'm just subtracting every pill, okay? I just subtract the amount that I gave. Then at the end of my shift, when it is time for shift change, me and the med tech that's going to replace me, we got to count all of these narcotics. Every card that is in the cart, we have to go over and count and make sure that they are accurate. So those papers will be kept in a binder. So not only do you have to document on your narcotics that you gave it on their MAR, you also have to document on those papers that come with the med. So it's two places. So then when that med tech comes in, we have to count these. So I'll have the book that has the sheets in it, but for every resident on our assignment that gets narcotics, and then she'll be at the cart looking at the packs. And so I'll flip through the book and say, all right, Miss Sue has 30 Percocets. So she's gonna look at the card with Miss Sue's name up here. It's gonna have her order up there, and she's gonna look at the numbers, and it needs to have 30 pills on the card. If there's 29, we're missing one, right? So it could be that I gave the medicine and forgot to sign it out. Okay, cool. That's an easy fix. Sign it out. Or since so many of these get stuffed in a drawer on the cart, what could have happened is that it popped out. So if I look in the bottom of the cart, I may see the pill. So I'll put my gloves on, pick it up, put it in here, put some tape over it, and keep moving. But what if I know I didn't give it? It's not in the bottom of the cart. So now it's really missing. What is the next step you think we should take? I'm going to tell the nurse, like, hey, I don't know what the pill is. I didn't give it. It's not in the bottom of the cart. So now at that point, a drug screen has to be done and a police report has to be made. Okay. Now, if you come in, the med tech's like, girl, I didn't give any meds. I didn't give any narcotics today, so we don't even have to count it. So he's like, all right, because that's your friend, right? Next thing you know, it's 1 o'clock in your shift. Your nurse comes and say, hey, let me do a narcotic audit. She go and start looking, and guess what? Cards are missing pills. Yeah. And he was like, she said, hey, you've been giving out pills and you haven't signed out the book. I haven't given out any narcotics. So who did? The one that said, I didn't give out anything. Yeah. Don't trust. When it comes to narcotics, do not trust anybody. I don't care who you're getting the keys from. Count the narcotics. Okay. It's a very serious charge because if you don't count it and you take those keys and that cart is wrong, you are assuming responsibility. You get in trouble. So count it. I don't care what anybody say. I don't care if they're in a rush. Don't care. If that narcotic count is wrong when you come in, you do not take the keys. That narcotic count has to be corrected. I wouldn't be doing the correction. It'd be between the person that had the keys and the supervisor. And I'm going to sit there until they get it correct because I will not take the keys because now I'm assuming that responsibility. This is very, very serious. If for whatever reason I have a narcotic that my patient refused or it dropped on the floor or whatever, and I have to discard it, I have to have a witness. But that's only with narcotics. So if you flip over to slide 26, every time a control count is done, it has to be two people. It's going to be the person that has the keys and the person that is relieving them. Okay? You maintain that log. Every time you give a pill, don't wait till the end of your shift to sign out your pills. Do it right then. Okay. And then all of these are going to be kept behind two locks. So I want you to highlight the bullet point, the second bullet point, and the fourth bullet point. So two people must be present each time. All controlled substances are kept in a double lock storage. The first lock locks the whole cart. The second lock is on the box where these are housed. So that's why it says a double lock. Okay. Slide 27 just shows you what a controlled substance logs look like on the computer. Okay. On slide 28, what I want you to highlight is anaphylactic reaction. Objective information, subjective information, that was taught in CNA. So we should know those. Okay. Again, when we talked about reactions or side effects, they can be mild or they could be severe. When someone is experiencing an anaphylactic reaction, this is a dangerous allergic reaction, and it causes the swelling of lips, tongue, and the throat can obstruct their airway. Okay, so they can die from this. So during that instance, we have to give them an EpiPen. Okay, and then of course 911 should have already been called and EMS should be en route. Okay, why is it that we need to report chest pains?
They may be having like a heart attack.
They may be having a heart attack. So on slide 31, I want you to highlight chest pains. All of these are signs and symptoms that must be reported immediately. So chest pain. So if I'm giving meds and they're experiencing chest pains, I need to go ahead and report that. They could be having a heart attack. Severe headache could be a stroke. Hot, severe, like their blood pressure is very, very high. Difficulty breathing, sudden weakness, high fever, loss of consciousness. All of these I need to report immediately, as well as bleeding, swelling, changes in their condition, or if they refuse a medication, I need to report that. Refusing a medication is not a medication error. That is their right. They have the right to refuse medications. You just need to document it. However, if they're refusing medications that they absolutely need, if it's for their heart, it's for their kidneys, it's for their lungs, it's for their brain, it's something, antibiotics, that they absolutely need to take, I will try 3 chances, 3 times to get that medication into them. If they continue to refuse on that 3rd time and I'm still in my medication window, all right, then I'll discard of it. If it has a narcotic in there, I need to have my supervisor watch me to get rid of it. The other meds, I need to discard however my facility tells me to. And then document. In your documentation, you need to state why he is refusing. Okay. All right, that was chapter 4.